Capnography is a measurement of expired CO2 with a waveform. It's a way to look. I like to call capnography as the measurement of a fundamental life process. In the body, you take in oxygen, it's delivered to the cells use it to live, and then the byproduct is CO2. CO2 is then excreted out of the body through the lungs, and then we can measure it. By that measuring, that's the first objective measurement of a fundamental life process we've ever had. And it's done non-invasively, so it's not tied to a skill level like a licensure for EMT basic, paramedic, or anything like that. Anyone who can put a cannula in their nose can measure it. And so it's the first opportunity we've had. I like to call capnography the most important clinical upgrade in the 30 years I've been doing this. And so if capnography is to be the revolution we want it to be, then we have to increase our education base and don't assume anything about our participants. We have to start from square one and work their way up. The 2010 guidelines for the American Heart Association gave capnography a Class 1 level of evidence A rating. Now, there's only been two things in the history of the American Heart Association ever to get such a high rating. One of them was 12-lead EKGs in the pre-hospital setting for diagnosing STEMI. That occurred in 2000. And in 2010, capnography got that level rating. A level of evidence A you don't get by having a halfway done research. This is pretty much universal across the board. And so we take projects such as that are done by physicians and hospitals and other researchers that prove the benefit of it, and then you can take any instance, use capnography from there and go to the literature. More recently, we have literature now that allows us to put nasal cannula capnography on people, and by measuring their waveform and their values, we can actually trend and triage patients and the severity of their asthma attack, and we can do therapy from there. There's research to support this that show that the correlation between the blood gas CO2 and the end-tidal CO2 is equal. And so once you can prove that physiologic balance, then you have a valuable diagnostic tool to help you understand more about the patient's condition. Furthermore, if you understand the patient's condition and you use capnography, you have a great trend for before and after therapy. And so what that means is you can better select patient therapies, you can see if it's actually working, and I'm talking about reliable and objective criteria, not something where we ask them, how are you feeling better? Or are your lung sounds still wheezing? Because a lot of times they may still be wheezing. But the capnogram can give you objective proof, and this has been borne out in the literature as well. Well, based upon what I've seen in my classes, I think that people have the technology, but they're just not sure how to use it. And again, like I said, that's because of the lack of education. Companies like Oridion and other companies who make capnography products, it's not that they haven't tried. The information's out there. I don't know if it's the fact that the educators aren't sure about it, they didn't use it themselves, or if there's just a big paradigm against it. How do you justify something you never had to have before? And that's the thing. So through sound education and through understanding the situation, understanding why people don't use it, then I think that's where we can come to the conclusion. In my own research with audience response, I've found out that the number one reason people don't use it is they say it costs too much. Second comes in, people say they don't use capnography because they don't know how to use it. Others have said they don't have the equipment. Others have said it's useless and the doctors don't believe in it. And so when I look at what they've said and what they're telling me, I can tie every one of those into ignorance. Now, ignorance is not a bad thing. It just means that you don't know. And there have been many quotes over the years about ignorance. As it goes on, one of them says, reason can stand alone, but ignorance will believe in anything it's fed. And so there are many things we can look at that way, but I think as an educator, I like ignorance because I can fix ignorance, but everybody knows you can't fix stupid. And so when it comes right down to it, that's the Ozarks saying from where I'm from in Missouri, everybody's ignorant till proven stupid. And so if you don't know, then you don't know. But if you do know and choose not to use it, well, that's not a good thing. And the thing is, it takes a whole system. It takes planning from the basic education to follow through to competency. Clinicians, whether they're EMTs or paramedics or nurses, they need to feel competent and confident in their skills in order to actually use this technology. Like I said, it's new. No one likes change but a wet baby. And so it's going to be up to us as educators and as clinicians to get the word out and let people explore this technology, get the right education, set up a program, do some planning, get with the entire community of healthcare professionals in your area.